One of the most common occurrences in young women is a history of lumps of the breast. Most women have some evidence of what's called fibrocystic change. That is, their breasts are said to feel lumpy or bumpy. For the most part, this is absolutely normal, and many women find that lumpiness fluctuates during their cycle. Many times, benign cysts of the breast can actually be painful, for instance, with the cycle or with caffeine. However, when a young woman has a dominant breast lump or a lump that sits out from the other lumps in her breast, so to speak, one should be sure that ultimately some kind of diagnosis is made. Young women often have very dense breasts, making mammogram difficult or sometimes useless. In that case, ultrasound can be helpful. And if there is what's called a dominant lump, it's quite easy for the mammographer or the mammography department to do a core biopsy of that lump. The worst thing that we see is a young woman who comes in with invasive breast cancer, who says, I've had this lump for a year, and they told me it was nothing because I was 32 years old. So if a lump persists and stands out from the other lumpiness of the breast, so to speak, one should always come to some diagnosis of what that is, irrespective of the findings on the mammogram and the ultrasound. In general, an outpatient core biopsy would be the most definitive way to decide whether this is something that needs follow-up or not. Many of these turn out to be fibroadenomas, which are totally benign and have no implication for increased risk of breast cancer in the future. Sometimes one gets atypical lesions, which may need to be resected and which may have some implication for future breast cancer. The other issue in such a patient is to always take a family history, and if one finds cases of breast cancer in the family, especially in younger women, or multiple cases, or bilateral breast cancer, or any ovarian cancer, or breast cancer in males, one should consider gene testing by seeing a certified genetics counselor to look at the pros and cons and indications for such testing.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.